So good morning, everyone. I'm Martin Hockwell-Hans from the Charité Hospital Berlin. And while many of you in the 6G Path Consortium represent technical expertise in network engineering and infrastructure, our role is to contribute the healthcare perspective, which means what do these technologies enable in real-world care scenarios, and what challenges do nurses face on the ground, and how can connectivity improve the outcomes for both the patients and the professionals. Just a quick overview over the agenda. The goal is to create a shared understanding on how 5G and 6G technology can support healthcare and more specifically nursing workflows and decision making. So first of all, I want to present our working group at Charité. The group is split into several groups into aging and technology, nutrition, body composition, immunoaging, and the nursing research. And we are part of the nursing research team, and our focus is on geriatrics and metabolic diseases. So we try to research, develop, and try to teach the medical students and stuff. So we use mixed methods in clinical studies, usability testing, implementation, and want to bridge the gap between the companies which supply us with technology and the medical sector. I just want to give you some of our projects in the overview. In the past and the current, we developed CareOne, which is a wearable sensor system for continuous vital monitoring. What's unique here is that it's ultra-low latency data transmission, which is crucial for early warnings in emergency situations. For example, when a patient falls sudden or drops in oxygen levels, we have to be alerted immediately to reduce responses time in both clinical and home care settings. Another project we were part of development is the Flexo 2, which is a human-machine exoskeleton designed for the use by the caregivers. The project addresses a common problem, which is musculoskeletal strain during patient handling and transfer. So the aim of the system is to support safe movements and reduce injury rates among nursing staff. And the last of the projects I want to present is Page at Home. The project focuses on the long-term digital monitoring of chronically ill and elderly people at home. So it includes a digital personal assistant that integrates multiple data sources such as vital monitors, medication adherence, and behavior patterns to detect early changes. This contributes to the preventive care model, potentially avoiding hospital readmissions or deterioration. Each of those projects depends heavily on fast, reliable, and secure connectivity. And that's why we see 5G and 6G not only as a telecom upgrade, but as enabler of scalable data-driven care models that work across institutions and settings. So the main part of the presentation is eHealth nursing, why 5G and 6G. So as we've seen in our projects and care collaborations, the digital transformation of the healthcare, especially the nursing, depends fundamentally on network infrastructure. It's not enough to develop smart sensors or telehealth platforms in isolation. What we really need is a robust foundation for data exchange, security, and responsiveness. And this is where we see 5G and 6G coming in. In nursing, real-time data is essential. So we need instant access to patient vitals, movement patterns, and alerts whenever we're working in acute care, long-term care, or remote and home care settings. The information must be reliable, timely, and secure. So our main focus here is the real-time monitoring, the remote treatment, which is currently rising in all of the European countries where we see the robotic systems, and of course, big data and AI-driven applications. From the technical side, I don't have to be so in detail. You all know that high data rates and low latency is essential to be used in our medical field. Another aspect, of course, is multi-session VR or XAR sessions for nursing education. Currently, we see those very rare in the practical field, and the goal is to connect people and hospitals from rural areas with university hospitals and start collaboration with remote areas to get them on track within the innovations we use in our daily life and university. Another aspect is in the daycare of nursing, quick and accurate decisions are often a matter of patient safety. So 5G and 6G technology can support clinical decision-making by enabling real-time access to data and at the bedside, in the home, or even in the mobile setting like ambulances. This means the data has to be up to date wherever we are. We have to access them. And of course, the efficiency of the resource use is one of our main targets, as we are usually short-staffed in the medical field. And of course, the reduction of errors is one of the main goals because we see a lot of redundant documentation and inadequate systems which don't talk to another. And our goal is that we create a platform and a communication tool where all of the applications are into one system and are capable of transfer data to each other. Then the robotic systems on the right side, you can see the Da Vinci surgery robot. It was usually designed to enable remote controlled surgery. Currently, it's only used for in-local surgery in highly equipped hospitals, and the intention of protect medical staff in crisis regions or battlefields is currently not achieved, and maybe 5G and 6G can be enabler for the primary intended use case of the robot. So to sum this up, all these innovations we talked about need real-time monitoring, the robotics, the healthcare, with the telehealth and the VR, we need the right infrastructure from the network side. The promising approach is the development of a campus network within the healthcare institutions. So every hospital or caregiver has his own network, and the benefits are very obvious. The data protection and privacy is always a huge discussion point we have to face, and I think the 5G and 6G network would tackle this in a very elegant way. Another aspect we're dreaming of is a future network called European HealthNet, where all the caregivers and stakeholders of the healthcare system are connected to, and we ensure that the data integrity and security is in one system and doesn't have to be implemented in several redundant infrastructures. But as you can imagine, there are a lot of challenges we're currently facing in the medical field. One side is the technical challenges, which are highly fragmented infrastructure, which lacks of interoperability, and the network coverage in the medical field is also partially low. So we have to make the transition from the existing infrastructure to leverage the system level the current caregivers have. Another problem is the implementation factor. So we see a lot of needs and wishes from the caregiver side, but of course they don't have the financial resources, and of course also the input from our side. How do we use those technologies so they really have a benefit in our daily life and not only for the academic world? And of course, on the other side, there's some regulatory considerations, which is always a problem when it comes to new implementation. They raise concerns about the data protection and the certification level. And of course, this has to be thought in the step of conception and development of each technology in the 5 and 6G technology part. On the other side, of course, the ethical perspectives, this is where we come in as Charité with our expertise and try to ensure that everything is ethical approved. And of course, we have to usually convince the caregivers that there are not ethical considerations which might harm their patients or themselves. To conclude, we developed an example of a future-ready hospital infrastructure where you can see a schematic of an edge service platform. This was a collaboration from HPE and Charité and shows which elements are essential in a modern hospital infrastructure. And I highlighted the part where 5G and 6G comes into it. So when it comes to build a new hospital or develop it any further to be on track with the current developments and innovations the market has to offer, 5G and 6G is essential and not a good to have. It's the basis where we have to build all of our network infrastructure also as a fallback when the wired network breaks. So let's conclude. The benefits and potentials are very clear. For the patient care, we have the interoperability between the devices and ensure that we have a complete data set of each of the devices and caregivers, which is accessible in real time. They have the enhanced security and data protection layer, and of course, the improved quality of life, which resides out of the data, which is processed by the caregivers, and then they can take immediate action and not wait until data is transferred. For the healthcare professionals, of course, there's reduced physical and administrative burden as we see systems which are networked together and the communication is very fast. There's more time for the direct patient interaction and evidence-based decision support, which is one of our main goals, and the caregiving is reached. And of course, the streamlined communication and documentation. On the research side and the healthcare system, of course, we can use the big data analytics for improvement of our current therapy concepts. And the goal is to reduce the amount of documentation and therefore resource allocation and efficiency is increased. So this helps to coordinate across between the different sectors and stakeholders, and in the end will lead to a better management of healthcare workforce. This was just a quick update for our use cases. I think we already talked about it at the beginning of the presentation, so I'll skip this to not stretch the timeline of the presentation. These are the references, and that's all. Thank you all for your attention.